Good day, peoples. This is Professor Master of Nothing, Teacher Tay, bringing Chapter 18 to your audio pleasure. Um, Altered mental status, stroke, and headache. So we'll get into it. All right, of course, AMS Education Standards, page 555. I advise everybody to go over their objectives. It's better to go over them before you start really getting to the chapter. It helps you highlight some things and learn the terms. The terms help out a lot. Alright, I already told you guys what the overview was. Altered mental status, which could be a range of things, stroke or CVA, and headache. Alright, altered mental status has many causes and can place the patient's airway at risk. That's one of the main concerns. Early recognition of stroke is critical. We like to say time is brain. Headache should be considered a serious symptom of possible underlying condition. People get headaches all the time, and we tend to take them for granted. So, basically, what they're saying, until we know better, take them seriously. All right. Dysfunction of the reticular activating system or cerebral hemisphere interferes with consciousness. Basically, to remain awake or conscious or in a conscious state, you need two functioning components: an intact reticular activating system and at least one cerebral hemisphere. The RSA isn't a structure, but it's more of a network of nerves in the brainstem that constantly transmit environment and sensory stimuli to the cerebrum. If something happens to the network, it causes an issue. The patient loses consciousness. There's a multitude of things that can cause these issues. I mean, anything from injury to an illness, whether it be a brain tumor, head bleed, you got brain infections, hypoxia can cause it, blood glucose levels are low, liver failure. There's just a bunch of stuff that can cause altered mental status, guys. So until we rule out these very significant things, we need to take altered mental status very seriously. These are some more causes of altered mental status. So until we figure out exactly what is causing a person to be altered, we need to treat any life-threatening injuries or conditions. Make sure the airway is protected. Make sure you document very well. Continue to monitor the patient. Alright. Alright, so when it comes to altered mental status, gut scene size up is very, very important. Can give you clues to what's going on with the patient. First, determine if the patient's been injured. That's probably one of the more obvious things you can kind of rule out just by looking and doing a quick sweep. If there's no mechanism of injury, then you can already suspect that it's going to be something medical with that patient, whether it be drugs or some type of poison or low blood sugar. But that's a way to kind of start broad and narrow yourself down to figuring out what's going on. There's no family members to give you a good history. Look at medications. They can kind of give you an idea of that patient's background. Look in the refrigerator, see if there's any insulin in there. Take a blood sugar. If there's more than one patient, you may want to suspect maybe some type of poison or carbon monoxide poisoning. So make sure you guys do a good scene size up whenever you're dealing with altered mental status. All right. All these things should be pretty much coming to you guys by now. If you don't know whether they fail, then you may want to look at stabilizing the spine. Definitely check the airway. You know, that's one of our mains. So I won't even go too deep into that. You guys should be real familiar with that by now. All right. You have your partner taking vitals. Some good questions you could be asking. You know, what were the signs and symptoms of the patient complaining of prior to the altered mental status? Did the signs and symptoms seem to get progressively worse or better? Does the patient have any known allergies, medications, prescriptions? You know, do they use drugs recreationally? Um, when was the last time you saw, a doctor for their medical conditions? These are all things that you want to ask. You want to find out exactly when this stuff started, the onset of the symptoms. That's going to be very important, especially when it comes to stroke, which we'll get into later. And how long has the patient been sick or suffering, or how long has all this been going on? All right. Get into your secondary assessment. Any obvious signs of trauma, deformities, contusions, abrasions, and such, any swelling, abnormal respiratory patterns, increase or decrease in heart rates, pupils, guys. Sometimes we don't check the pupils. Pupils can be a good indication of sometimes what's going on in the brain. So check those pupils. Do they have high blood pressure, low blood pressure, any battle signs, discoloration around the eyes, raccoon eyes? What's the skin look like? Is it pale, cool? Is it moist? It's all things that you want to be kind of looking at to get an idea of what's going on. All right. All right. Just make sure you're documenting all this stuff. It's just getting further into your secondary assessment. And this is also just assessing the patient. All right, for these critical patients, reassess every 5 minutes. Look for any changes in mental status, airway, breathing, and circulation, and make sure you're recording this stuff. All right, when the patient loses some or all of their ability, they experience a neurological deficit. The neurological deficit is defined as a deficiency in functioning of the brain or the nervous system. Neurological deficit alerts you to the possibility of a condition that is affecting the patient's central nervous system, which is composed of the brain and the spinal cord. You must look for signs and symptoms of both traumatic and or medical conditions. Time is very critical. There's a stroke chain of survival. First off is rapid recognition of stroke signs and symptoms. 911 call taker recognize the signs and symptoms of stroke, resulting in a rapid EMS dispatch. Rapid EMS response, assessment, recognition of stroke, and transport while providing pre-arrival notification, meaning call the hospital, let them know you got a stroke coming. And for us, we have the stroke system, so you want to call them and make sure the hospital you're going to can accept the stroke. And rapid diagnosis and treatment by the medical facility. That's stroke chain of command, and it is very important because the more time you waste, the more brain that is lost, and less of a likely chance for them to fully recover back from that stroke. We already kind of talked about this. Like I said, time is very critical. You as an EMT can make the biggest difference between cutting that time down. And also, it's very important for you to find out, when these symptoms started, so you can pass it along to the accepting facility. Alright, so over time, a clot can form inside a large cerebral artery, and it increasingly blocks the flow of blood. The small and surrounding arteries begin to dilate and supply more blood than normal to the affected area of the brain. The blood supply from the smaller arteries is referred to as collateral circulation. Let's see. Most times, collateral circulation is not adequate enough to supply the needs, so then the cells become ischemic. This is very important and happens quite often, and you know that those headaches that they may be complaining of, this may be why, which could be leading to a stroke or causing a stroke. So you guys make sure you pay attention to these people complaining of headaches, or you know, I got weak, you know, a month ago on my left side, but it just kind of went away. So these are all little clues and things that you can pick up on. All right, guys, there's two types of there are two main types of stroke, which is ischemic or hemorrhagic. Basically, hemorrhagic occurs when one of the cerebral arteries ruptures and bleeds into the brain. And of course, ischemic is caused by thrombus, which is formed inside of the walls of the arteries, and embolus travels from one area to another and gets lodged and cuts off blood flow. So they're both stroke, two very different kind. We have no way of telling, really. We can't do CT scans in the field, but still you need to know these two different types of strokes. Alright, the brain tissue distal to the rupture or thrombus or the embolus receive little to no perfusion and become ischemic or starved of oxygen, and eventually infarcted, which means dead, of course. When a thrombus grows slow enough, collateral arteries may form a parallel to the blocked artery to perfuse part of the area that is ischemic. But that, of course, that takes time and is normally not enough blood flow. We already kind of talked about this, the two different types of stroke and how they're caused. So I won't beat that into the ground. All right. We've also covered much of this. When a clot develops and causes an occlusion, it's called thrombus, and the process of that clot formation is referred to as thrombosis. Especially when the body ages, we get fat deposits, which we call plaque, in the inner walls of our arteries that sometimes break off and cause this to happen. AFib causes this a lot. Just defibrillating of the heart, blood tends to pool and clot, and then those clots are then released into the body and can cause these blockages. So if a patient has a history of AFib, you have to kind of think, have they thrown a clot? So that's just one of the other things that can lead you to a conclusion. When it comes to hemorrhagic strokes, people with high blood pressure, that's why you're looking for, you're looking at a history of high blood pressure. They could have be super hypertensive within that moment. That could be, it could be a hypertensive crisis, or it could be a rupture of a blood vessel that could be causing an altered mental status. We really don't, you won't have a way to say per se, but you want to try to draw a conclusion to pass along to the medical team. All right, hemorrhagic strokes are usually caused by either of two types of weakened blood vessels, aneurysm, and you have people that know that they have aneurysms that walk around and they can tell you, or a family member can tell you that they had an aneurysm and now they are showing stroke symptoms, or arterial venous malfunction. An aneurysm is basically where the wall of an artery gets weak and it balloons. I don't know if you've seen a car tire where the wall gets weak and it forms a bubble and it causes a blowout, basically is what happens. An AVM is a tangle of abnormally formed blood vessels in the brain or on the surface that divert blood directly from the artery to a vein. They bypass the capillaries. It's a congenital abnormality, and it occurs in approximately 1% of the population. So it's not a very common thing. All right, most of the signs and symptoms are the same between the two types of strokes, but for hemorrhagic stroke, it depends on what area of the brain it's in. Common signs include nausea and vomiting, headache, and decreased level of consciousness or altered mental status. Hemorrhagic stroke, some people say they had the worst headache they've ever had. If you ever hear that, your ears perk up. You should start thinking that's not good, especially if it wakes them up out of their sleep. That kind of stuff you really need to really pay attention to. Nausea, vomiting, light gives them a headache, makes their headache worse. So these are all things that should lead you towards those things. Hopefully we are all familiar with the FAST exam. Signs and symptoms include paralysis on one side or another, slurred speech, odd sensations on one side or the other. Patient is normally able to think, I want to move my left arm, but they can't move it, or they'll tell you that it's they want to do something and they just can't. So just pay attention to these things and know your signs and symptoms and act fast. Stroke and a TIA. Same signs and symptoms. Symptoms just disappear, usually within an hour or so. Emergency care for TIA is the same as for a stroke. We often call TIAs mini strokes. All right. Rarely does it affect both sides. Normally it's one side or the other side. You have anterior and posterior circulation strokes. Signs of anterior is paralysis, of course, motor deficits, numbness and tingling, language disturbance, visual disturbances, eye gaze, they may look to one side. Posterior strokes, circulation strokes, same thing for the most part. Paralysis and motor deficits, numbness and tingling, language barriers, vision disturbance, unable to talk or swallow, and vertigo. TIAs, pretty much, like I said, the same as a stroke. Normally, the symptoms don't last more than 60 minutes, though, and that's the difference. They resolve, and 10 to 20% risk of stroke in subsequent 90 days. Half of these within 24 to 48 hours. So person has a history of TIAs, the likelihood of them having a stroke or a reoccurrence is very high. All right. Cryptogenic stroke can't be attributed to a specific cause, thought to be secondary to AFib. Cryptogenic stroke is defined as one that can't be conclusively attributed to an embolism originating from the heart, thrombosis in the artery, or small artery disease despite intensive medical diagnosis testing. Cardiac embolism secondary to AFib is thought to be a common cause. Other possible causes include defect between the walls of the atrium, thrombophilia, which is an abnormal tendency to form clots, non-bacterial infection to the inner lining of the heart, endocarditis, and cerebral vascular disease. All right, scene size up, determine the nature of the problem, note where the patient's found. You know how to go through your assessment. You want to check all these things. We do this on every patient. It's just important to document it very well. Going back through your secondary assessment, I won't go too far back into that. All right, this slide is just on the different types of pre-hospital stroke screening tools. You guys can look these up. Most people are familiar with the FAST system. It's quick, it's easy, and that's what most of us use. Good history is very important. Good physical exam, and definitely vitals, because you want to get a trend of vitals to see if those vitals are improving or getting worse. Dangers of administering too much oxygen in a stroke patient. You got free radicals that cause tissue damage. You just want to provide enough oxygen to titrate to 94%. Too much oxygen can cause the vessels to constrict or further occlude, so we want to be careful of that. This is basically just showing the face of a non-stroke person versus a stroke person, so you can just kind of see the differences. The face isn't symmetrical on the patient with a stroke. This is the arm drift test. You just have your patient close their eyes, you hold their arms up, palms facing up, and you see if excuse me, you see if one of the arms tends to drift downward, which indicates weakness in that arm. All right, this is the Cincinnati Prehospital Stroke Scale. It just basically goes through what you're looking for: facial droop, arm drift, abnormal speech pattern, muscle paralysis. This is another testing, the Los Angeles Prehospital Stroke Screen. You guys can look over it. These are all stroke indications: loss of speech, sensory, motor function, altered mental status. And it's just going back through the assessment. We always keep a checklist on our truck, a thrombolytic checklist, as well as a FAST exam that has every bit of information you need for a stroke patient. So those are always good. So, and rapid transport is very important. Headache may be a condition in itself, or it can be a symptom of another condition. Just don't take them for granted. Headaches. Types of headache. You got vascular headaches that occur because of dilation of distension or vessels or inflammation within the cranium. Migraine headaches are thought to be caused by spasms of the vessels, followed by vasodilation and a change in the chemicals that transmit nervous impulses to the brain. Migraines are often described as throbbing and can be generalized or localized on one side of the head. Patients also experience sensitivity to light, which is photosensitivity, nausea, vomiting, sweating. Vascular headaches can be caused by hypertension. And then you got cluster headaches, which are headaches that are repetitively in clusters. They're similar to migraines because they are believed to have vascular origin. And there's tension headaches and organic headaches, which are also called traction or inflammatory headaches. All right, during your scene, size up, look for any clues that might be associated with toxic exposure. Assess the airway, ventilation, and oxygenation status. Only give oxygen if it's needed. Oxygen can relieve a cluster headache. Assess pulse and perfusion. Pain can cause the sympathetic nervous system to kick in and cause tachycardia, and cause them to become pale, cool, and clammy. Just get you a good history and a good secondary, and go from there. Suspect a serious underlying condition with any of the following findings. First experience of this type of headache with an abrupt onset, meaning they don't have a history of it. This is new. Worsening pain with coughing, sneezing, or bending over. Fever or stiff neck. Change in quality of a chronic headache. Of course, just going back through your basics here. In summary, causes of altered mental status includes structural or metabolic toxic causes. Strokes may be ischemic or hemorrhagic. Time is of the essence. Time is brain. Use a validated stroke scale. Headache may be a condition itself or a symptom of an underlying issue. And that is it, guys. Thank you for hanging in there with me.